topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, San Antonio, one of my favorite cities. Welcome to another Ask the Expert show where for the last 16 years we have brought you the top experts in the field of legal, health, financial, and home improvement. Today's show, I got to tell you, it's so dear to my heart. I'm on Medicare, not afraid to admit it, love Medicare. I got to tell you, this show is hopefully to help you not make the same mistakes that I made, because I didn't know there was a show like this that could answer all my questions, and I ended up having to pay some penalties. But we have got the greatest Medicare agent for all of San Antonio. I love the name Medicare Gals, a signature team. Let me welcome Susan Shimp. Good morning, Susan.
Good morning. How are you?
Listen, I am in awe. You're going to Washington Saturday.
I am.
To meet with our politicians and talk to legislators about Medicare issues. I'm blown away.
Yes, I'm so excited. So every year, insurance brokers from across the country can go to Washington, D.C., to Capitol Hill, speak with the legislators. And basically what it is February is the time of year that you start the process of negotiating the policies for Medicare for the following year. So February begins that. So we're going to be involved in all of that with the legislators, and there's a lot of kind of interesting reforms that they're looking at, and we get to be a part of that. So it's very, very exciting, and we get to change stuff.
Do you have your list ready?
I do.
I knew you would. You would.
Yeah. So basically, what at the Capitol, what we're going to be discussing is price transparency and reform. So, when you walk into a store, you know exactly how much that item costs because it's got a price tag, right? Healthcare doesn't have a price tag. You walk into a doctor's office, you walk in to have a surgery, you walk in and you go to the emergency room. There's no posted price of what you pay. It's all different. So they're looking to do, it's called the Patient Deserves Price Tag Act. So the patient deserves a price tag. So that's kind of a really cool thing because, you could go to one hospital and it could be $400. You could go to another hospital and be $4,000. So there is no transparency. There's no common ground when it comes to pricing in Medicare. So that's one of the things they're actually looking at, which I completely agree because, I always said it needs to have no surprise billing, right? No surprise billing. You get it all the time. You get the bills later and you're like, wait a minute, I thought I paid everything. So that's one thing that's really cool, and hopefully it'll come to fruition. Another thing that they're looking at is long-term care. So long-term care is not covered by Medicare. So if you have a loved one that is, going into a assisted living facility and needs 24-hour care, that's on you. Unless you have it's very expensive, $9,000 to $10,000 a month. And unless you have a long-term care policy put into place, previously, then it's on you or the family to come up with that kind of money. So, it's called the Wish Act. And what it is they're going to try to help protect retirement savings, reduce caregiver burden, and kind of do a proposal like Social Security structure. So you would be able to, like, you're paying into a fund, so to speak, to help alleviate costs for that family. So this is going to be interesting. A lot of people just, can't afford it. And so there's a lot of family members. And even if you don't have family members, it's a burden on neighbors. It's a burden on, your grandkids. It's a burden on everybody to try to help somebody because you can't afford it. So long-term care is very important. And that is one thing that, they need to look into. It should be part of Medicare. It's not. And that's kind of, hopefully they'll talk about it more.
So I have a question. Maybe this will be brought up. So the president came on, I guess, several months ago with several of the top pharmaceutical companies.
Mm-hmm.
And he had worked a deal out that we were going to give nation, I guess, where we would get the same price that other countries were getting, much lower, sometimes as much as 80 or 90% lower.
Mm-hmm.
I haven't seen that go into any of the costs at all.
Well, guess what? That doesn't affect people on Medicare. So the Trump RX, that whole thing that came out, does not have anything to do with people on Medicare, because people
Wow.
on Medicare already get the lowest rate possible when it comes to prescription drug costs. So it affects people on private insurance, commercial insurance, and people with no insurance.
Mm.
So it doesn't even affect people on Medicare. And that's the thing. They're like, everyone's like, oh, this new program came out. Only a certain amount of people will be affected by it, but people on Medicare, absolutely not.
Wow. So what do you plan to accomplish after this meeting in Washington?
Well, I'm hoping, I mean, we're the feet on the street. We're the ones who
Yes.
talk with the Medicare beneficiaries every day. We know their issues, we know their concerns. We're little small people in San Antonio, and all across the country, but we have a big voice. So I'm hoping that they actually do understand where we come from, because honestly, also on the agenda is they're looking to eliminate some, it's called third party marketing, these call centers, right? These call centers, unlike us as local independent agents, these call centers have quotas they meet. They don't care
Mm.
about you on the other side of the phone. They are basically saying, okay, we need to sell so many of this policy today. And so they're trying to call you to switch you to make that change so they hit their quotas. Whereas us as independent brokers, we care about you. We care about how, you get your health care, how much you have to pay, all this stuff. We don't care about quotas. We care about helping you. So we're hoping that they see the difference between a call center and an independent broker, because right now they're lumping us all together as if we're one person. We're the bad guys, right? We're the ones trying to switch people and stuff. That's the call centers. That's the 1-800 call centers. A good broker, a good local agent will not call somebody without permission.
I am so glad that you brought that up because I'm constantly with the show doing due diligence. And I actually called the call center for the company I'm with, and I actually did it 3 or 4 times.
Mm-hmm.
Susan, I got 3 or 4 different quotes
Yeah.
from the same company.
They don't know what they're talking about. That's the thing.
Exactly.
I always tell my clients, never ever call the insurance companies unless I tell you to, because most of the time they're reading from a script. They have no idea what's going on, and they're not licensed. Most of them are not licensed who answer the phone in the beginning. So, uh, trust me, it's like and then you talk to somebody who's overseas and you can't really understand them. A lot of people complain about that. So, you know, I get it. I 100% get it.
Yeah, I'm curious. This conference, has it always been done in the past?
Yes, it is a yearly conference. It's been done for decades. But it's called the Capital Conference. It's through NABIB, which is the National Association of Benefits and Insurance Professionals. So I'm a member of that. And we are basically our advocates for our seniors. And it doesn't only just do Medicare, it does ACA, the Obamacare stuff, the marketplace stuff. It does employer insurance, all that stuff. So it is all combined as one, but we segment out for each. I'm a Medicare broker, so I obviously would go with the Medicare side, and the employer plans would go with the employer segment. So we are all one, but we're one big voice. And yes, it's been going on for decades, and it's just a good way to bring local to the national stage.
I have to tell you, Susan, and it's funny, we're getting texts coming in. A lot of people are asking, do you also handle health insurance?
Yes, I do have a lady on my team who does the health insurance on the under 65 side. Her name is Miriam Soto, and she will help you guide you with that. She's a broker as well, which means she's contracted with all the insurances. So we do young, we do old, so anywhere in between.
So I got to tell people, because when I first got an agent in Florida, you don't know anything when you hope that the agent is going to walk you through everything. But I apparently got a very lazy agent who gave me one plan. See, you represent a lot of different companies, correct?
That's correct.
So you're not tied to one company.
No,
So what you do with your clients is you offer them different plans to choose from.
that's right.
I I did not have that luxury. And it took me going to finding another agent to find out how lazy my agent is. It is so important that you get a good agent like Susan. And one of the things I'm learning about her, because you had a TV background, right?
That's right.
How did you go from TV to Medicare?
It was a definite pivot, that's for sure. I mean, I love TV. I like to help people either behind the scenes or in front of the scenes. So it was a weird transition throughout the years, but I ended up getting into Medicare because of a best friend of mine who got into Medicare. And she said, you know what, you've got the personality, you know how to talk to people, and you could do this. And I was kind of like hesitant. I'm like, it's kind of not my cup of tea here. But now I could not imagine my life without Medicare. I mean, I breathe, eat, sleep, live Medicare.
But this is the reason why I knew you were going to say that. The reason I brought this up is you so have a heart for other people. And when it comes to Medicare, which is an older demographic, you've got to have patience. You've got to
Absolutely.
have a heart for it. And I want people to know there's a lot of agents in the San Antonio area. We
Mhm.
were so lucky to find Susan. And we're basically have done the legwork for you, finding a good agent and someone that really does care. And Susan, I know how important customer service is to you.
Yes, that is one thing I pride myself on. Me and my team, we deliver concierge white glove service, so to speak. I mean, we walk you through everything. We are holding your hand throughout the years. We don't just sign you up and say goodbye. We are always there. We keep in touch with you with newsletters. You get birthday cards. Like yesterday, for example, I did a coffee and chat with my Medicare clients. So I got a little place in New Braunfels and had a little coffee and some pastries, and we just talked Medicare and kind of hung out. from 10 a.m. to 1 p.m. So it was kind of nice. So I like to be involved with my clients. They'll bring their bills and they're like, "Hey, I got billed this. Can you help me?" So I look through it, and any concerns, any questions, any issues, that's what I like to do. I like to do that needle in the haystack kind of thing to try to help my client as best as possible. And, that's the concierge service that we provide.
I got to tell you, because our number is constantly out there, our email is constantly out there. People love your show. And again, we're so lucky to have you. I want to know, because I am on Medicare Advantage. I keep hearing talk about it maybe being cut or going away. Any
Well,
thoughts?
yeah, it's not going to go away.
Okay.
There may be a few years where it's going to be kind of rocky, where maybe some of the benefits will be pulled out due to cost with these insurance carriers because they're not getting paid by Medicare as much as they used to. So they may reduce some of their costs. I mean, reduce some of their benefits a little bit more, maybe in the next couple of years. But on the horizon, Medicare Advantage looks pretty stable. We just got to get over a few more humps and then we'll be good.
Well, I'm sure there's people who are getting ready to turn 65. What should they be doing now to enroll in Medicare?
Well, first of all, if you're 3 months before your 65th birthday, that's your initial enrollment period. So that's when you can start your initial enrollment into Medicare Part A and Part B. Those are the two parts of Medicare. And once you enroll into Medicare, if you're not working and you don't have any employer coverage or any medical coverage, then that's when you enroll into Medicare. And then you want to call us at the Medicare Gals. And our number is 210-767-9876. And I always laugh because my daughter, and I know people will know this meme. I'm 210-767-9876. That whole meme they have.
Yes.
Yes.
So you're excited about your trip?
Yes, I leave Saturday morning and then I come back on Wednesday. So it's going to be a good little stint up there. And I actually get to speak to I get 2 Democrats and 2 Republicans. So it's kind of bipartisan. I get the Joaquin Castro, who's really big here in San Antonio, and Representative Senator Chip Roy as well. And then 2 other ones I'm not too familiar with, Garcia, and I don't remember the other one. Oops, sorry.
That's
But
big time, Chip Roy.
yeah, so I'm excited because the 2 big ones are Roy and Castro. So, we actually, and there's only like 7 of us that get to sit down with them. So it's kind of cool.
So, Susan, do you know where your code is? Because
Oh,
San Antonio weather and Washington, D.C. weather.
yeah, we're in the 80s right now. We're probably going to be in the 40s, 50s up there. So yeah, I got to bring my coat for sure.
Yes. So getting back to Medicare, what's the difference between original Medicare and Medicare Advantage?
So good question. Original Medicare is typically there's 2 parts to Medicare, Part A and Part B. Okay, that's what you usually get, that red, white, and blue card. Now, original Medicare is 80% they pay, 20% you pay. However, you can pick up a Medicare supplement plan, otherwise known as a Medigap, that gaps that 20%. It pays that for you, but you do pay a monthly premium to have that insurance pick up the 20%. So that's one option. You can go to any doctor that accepts Medicare nationally. There's no prior authorizations, no referrals. You just come and go. Medicare Advantage on the other side is known as the Part C. It's Medicare Part A and Part B. And combined together with your prescription drugs, it's called the Part C. Now, this is a little different. This one, it's kind of more like of an employer plan. There's HMOs and there's PPOs. If you don't know the difference, I'll explain that to you when you call me. But the difference now is it's a network of doctors. So you can't just go to any doctor that accepts Medicare. You have to go to doctors that accept your insurance. So that's where we come in to kind of guide you to say, okay, what's the best plan for you that fits everything without losing your doctors, but keeping your costs low. And so what happens is there's usually no monthly premium for that. Whereas on the original Medicare side, you do pay a monthly premium, but there's a give and take. There's no bad way. It's just how you want to pay for your care. And we can dive deeper into that because it's a lot to kind of go over in, a short amount of time. But definitely there's options. And know that we go over both sides for you so that you know your options and you make the right decision for yourself.
We just got through doing a show in New York for Medicare. Does Texas have high deductible?
Yes, they have a high deductible plans. Yes. And depending on how often you use your plan can determine, how much you're going to pay. So I don't have many people on a high deductible plan. I have a few, but there's certain situations that you would want to look at when it comes to that.
But I got to say that I had never heard it's a Plan G.
Mm-hmm.
I'd never heard of the high deductible, and maybe we can touch on that next month when you come on the show again. Tell people again how they can reach you.
Okay, so you can reach me at my phone number is 210-767-9876. You can go online at my website, www.medicaregals-st.com. And I am located in New Braunfels off the Frontage Road, exit 191, just south of Buc-ee's. You can't miss us.
I got to tell people, I am telling you, I have personally met with a lot of Medicare agents, and we do shows all over the country. I'm telling you, I don't care if you've got another agent or not. Susan Shimp is so good at what she does. She will make your life simpler, and she will give you all your options, and she really does care. Susan will be back again with us next month. Susan, thank you so much.
Thank you.
I can't wait to hear about your trip next month.
I know, I'm excited. Can't wait to tell you.
Travel safe. God bless. That's Susan Shimp. Hey, that's going to do it for us today. We'll be back with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.